Welcome back! Drug courts today and coercive treatment. But since neither of those things are well defined, if you feel lost, remind yourself that this lecture is the coercive intervention lecture. Everything here is in service of getting a handle on coercive intervention, its nature, justifications, and apparent comparative outcomes. The intention is not to float up into the world of abstractions like free will or what social policy should be. I am not one of the self-declared anointed ones telling you how my system would be perfect. I just want to describe what is in front of us, not what should be in front of us. And this is what is in front of us. People being made to do things for the apparent good of themselves, their families, and their neighbors. We will start with some obvious but sometimes difficult to encounter facts. Obvious but difficult to encounter fact number 1, addictions are related to crimes. The most common psychiatric disorder in individuals accused and convicted of crimes is, by far, substance abuse. Note that this refers to the DSM-4 criteria for substance abuse being met. This was before the trouble with the law criterion was swapped for craving. Numbers would be lower by DSM-5 standards for this graph. Whether that means driving drunk or drug trafficking is therefore not substance abuse, I will leave up to you. I just thought I should explain the 90% number there. It's an obscenely high rate. We could pit 3 causal explanations against each other here. One says that substance use makes crime more likely. Another says that some other factors, like personality and context, make people more prone to both crime and substance use. And a third says that crime gets us into patterns and situations that increase likelihood of substance use or the diagnosis of it. If we allow for more than one thought or model in our head at once, and we realize that these things unfold not in an instance but across a series of instances, the yellow explanation would have us admit that use influences the personality and contextual factors that influence itself, so the left side is now our first loop. Note that now, some other thing can exacerbate both use and other things that use exacerbates. And even if we're not permitting the orange model to exist, this loop can produce crimes. I.e., even if we don't think substance use causes crime, by the yellow and purple model, use can still lead to crime through other things. And then our third model can make things even more recursive because it says that crime gets us into patterns and situations that increase likelihood of substance use. So in simply exploring these 3 relatively simple options, use causes crime, other things can cause both use and crime leads to things that promote use. In simply exploring these options, we found several trans-theoretical models, or dynamic ones. A mistake many students make here is to conclude the simpler models are wrong, or in more fashionable jargon, problematic, simply for leaving one of the infinite number of things in the world out of the model. The epistemic fact is that all models are wrong, but we make models because even when they are wrong, they can help us make better decisions. Models help us to be less wrong and never absolutely right, and they do this by simplifying the world. They work by leaving things out. Behaving as if the sun rises is quite helpful, even if it is the earth that turns. Behaving as if substance use causes crime is quite helpful, even if it is context and character that loop crime and substances together. Okay, but how do we know that there is any connection between substance use and crime? Statistics and self-report. If we do not count administration of justice offenses like breaching probation or failing to appear for court dates, the single crime most prosecuted in Canadian courts is driving while impaired. Some of us may think that all substances should be legal, and some may also agree with the courts that impaired drivers should be treated with lenience, but hopefully nobody thinks that driving impaired should be legal. And hopefully nobody thinks that driving drunk caused drinking, or that making it illegal, i.e. criminalizing impaired driving, is to blame for the behavior of impaired driving. Nearly all of us know a victim or two of drunk driving. It is hard to intellectualize this particular problem away, and thus easier to see the value of a simpler model in this case. Alcohol-impaired driving offenses are in decline, but Drug-impaired driving is one of the few places where Canada's crime statistics are getting worse. The drug-impaired drivers may have always been there and we're just better at detecting them now, but the fact is that they are there. And wherever such a thing is feasible to do, stopping substance use would absolutely stop impaired driving. Where preventing substance use is not feasible or ill-advised, please use more complex models for your interventions. Where it is feasible, I would stick with the orange model. Recalling that facts don't need theories as much as theories need facts, let's continue with obvious but difficult fact number 1. Addictions are related to crimes, and not just because some substances are illegal. Some numbers. 75%. In 2013, 75% of Canadians accused of homicide were intoxicated at the time of the offense. Zooming out and looking at physical assaults more broadly, the number's 29%, and looking at weapons offenses, 27% involved an intoxicated defendant. Roughly 50%, the rule of thumb for emergency responders seems to be that half of calls will involve drugs or alcohol. Any EMTs or peace officers, please feel free to comment whether that is your personal professional experience. It seems to be a general rule. 63%. If we narrow our sample of interest to the population of offenders in prison, 63% of offenders report using drugs or alcohol on the day they committed their offense. In female lockup, 77% of Canadian offenders are diagnosed with substance disorders. And if we eliminate the mild cases to adjust for the trouble with the law criterion, that number is still above half at 55%. 55% of females in lockup in Canada have a diagnosable moderate or severe substance use disorder. 82%. If our population of interest is Aboriginal Canadian offenders in lockup, 82% have diagnosed substance use disorders. And much like blaming the illegality of impaired driving for impaired driving was not helpful, we should not intellectualize or define away this difficult problem. We need interventions that are actually going to help here. Other relevant numbers here come from the United States or combined samples. 20% of prison inmates report that their crime was committed specifically in service of obtaining money to buy drugs. 25% report that they were intoxicated at the time of their offense. 30% of those surveyed on probation report having done illegal drugs in the past month. And rates of illegal substance use in prison, where one would think it would be quite difficult to obtain the substance, have been found to be as high as 40%. In a 2003 study of urine tests taken within 48 hours of arrest, 86.4% of female arrestees tested positive for alcohol. Since the 1990s, well-conducted experimental work has shown that it is quite reasonable to conclude that alcohol causes violence and aggression. Of course, since violent acts and aggression do not occur in a vacuum, we should be reasonable about interpreting a main effect of alcohol, i.e. a liquid made me do it. But psychological studies rarely find effect sizes as large as we found in these controlled experimental studies. To the extent that one thing can be said to cause another in psychological literature, we can say that alcohol causes aggression. Finally, from Mood Disorders Canada, 44%. 44% of youth prostitutes surveyed said they started that work to earn money for substances of abuse. Okay, but some of these statistics are more relevant to the connection between crime and substance use than others. How about some more targeted odds ratios? If I have someone who uses a substance versus a similar someone who doesn't, what is the overall increased chance of the user committing a crime? Regardless of why, how much does the chance of committing a crime change from non-user to user? The crimes most represented in this large and highly cited 2008 study are property crime, theft, and shoplifting. Prostitution is included as well. Keeping in mind that these numbers are obviously not counting the crime of using or obtaining the substance itself, the overall increased risk of committing a crime is 2.8 times greater for substance users. Now that overall number collapses across a lot of important information, so let's look at the breakdowns by substance. The mean odds ratio for heroin, including other opiates, is 3.6. In other words, All other things being equal, if someone goes from not in the heroin using category to in the heroin using category, the stats place that person as 3.6 times more likely to commit property crime, steal, shoplift, or enter the sex trade. For crack, the user is 6.2 times more likely to commit crime than the non-user. For cocaine, 2.6. For marijuana, 1.5. And for amphetamines, 1.9. The substance of abuse clearly matters, even though most studies, such as the next one, do not separate out alcohol or marijuana from other drugs of abuse. The next study looks at recidivism risk. Recidivating refers to committing another offense after being released for a previous offense. This meta-analytic study, that is a quantitative study that brings together many other quantitative studies, looked at the size of the relation between substance abuse, alcohol or drugs lumped together, and committing another crime. In this context, substance abuse was predictive of reoffending generally, with a small but significant effect size of 0.2, and substance abuse was predictive of violent reoffending, with a smaller but also significant effect size of 0.13. And keep in mind that this is a meta-analysis, a study of studies. There are between 50 and 100 separate studies that find similar numbers. Since these effect sizes are admittedly small, presented for you here are also the other predictors from this same quantitative study of quantitative studies so that you can compare the effect sizes. If you think, for example, that education or employment or family situation is more important than substance use in predicting reoffending, you can check the comparable numbers on your own and see the degree of predictive difference, the relative sizes of the relations here. But for fear of wading too far into the statistical weeds, this is all just to show that addictions are related to crime. Two things before we move on. First, some of the most seductive theories of the crime and addiction link involve impulsivity. Whether you think impulsiveness leads to both use and crime, the yellow model, or substance use changes the brain to make users impulsive, the orange and purple model, it is clear impulsiveness has some role to play. This 2021 longitudinal study suggests that substance use is associated with lower conscientiousness. When conscientiousness gets low enough, we start to call it disinhibition, an important word in clinical charts. Disinhibition refers to poor planning, poor foresight, and poor self-regulation of mood, urges, and behavior. Alcohol and nearly all other substances of abuse are associated with reduced conscientiousness. But this longitudinal study suggests it is more due to general group differences between users and non-users than the substance changing the user's brains. The dark bars are the between-group differences in personality traits between users and non-users. The lighter bars, where they are long enough to actually be seen, are the within-group changes in personality that individual users experience over the course of their use. Shown first here are the differences for heavy alcohol use, defined as drinking 5 or more days per week and binge drinking within the last 7 days. For conscientiousness, we see that heavy alcohol use does not show notable within-person change, not much light-colored bar, but heavy users as a group are significantly less conscientious than others. That's alcohol. Being in the heavy alcohol user category reduces mean conscientiousness by around 0.2 of this scale, and it appears to be a difference between users and non-users, not a change that occurs within the user due to the substance. Moving on to soft drug use, a category that mostly consists of marijuana users, Schedule II controlled substances in Canada. Here we see a similar relation. No notable within-person personality change, but a notable between groups difference, roughly twice that of the heavy alcohol use group. Being in the soft drug user category reduces mean conscientiousness by around 0.4 of this scale. The study also separately looked at some Schedule III substances like LSD and psilocybin, so check out this study if you're interested. There's a lot of stuff in here. It's a huge longitudinal study. So, no significant within-person change in conscientiousness, but considerable group differences for being in the soft drug use category. We will end our tour here at the hard drug users category. This group consists of users of opioids, cocaine, and other stimulants. i.e. mostly Schedule 1 substances in Canada, we again see no within-person reduction in conscientiousness, but considerable between-group differences. Being in the hard drug user category reduces mean conscientiousness by around 0.5 in this case in this big longitudinal study. I will let you decide which model or models you think these results support or refute, if any. The second thing, before moving on, I would not say simply here that substances or addictions lead to or predict crime. Our purview in psychology is much wider than that. Substances and addictions lead to and predict decisions and actions that go against the well-being of ourselves and others. In other words, substance abuse predicts bad decisions of varying levels of severity, some of which happen to break laws. Obvious but difficult fact number 2, punishment of addiction behavior and crackdowns on addictive substances don't work, or at least don't work for long. This large 2017 study out of Florida showed that prison time for drug users does not prevent reoffending. Offenders thrown into prison had the same recidivism rates as those given shorter jail stays and probation. This was regardless of the characteristics of the substance or of the offender, with one exception that those identified as white were more likely to reoffend if they had prison time versus no prison time. In other words, the one subgroup in all of their subgroup comparisons where a difference was found, it was in the direction of prison leading to worse reoffending outcomes. Now, recidivism, reoffending, is not the only outcome of importance. There could be reasons to prefer prison sentences over probation, but this and other studies at least contradict the idea that harsher sentences for drug offenders reduce reoffending. Overall, harsher sentences do not reduce drug reoffending. Similarly, and of no surprise to anyone who has thought about economics for more than 5 minutes, crackdown on drugs do not lastingly reduce drug use or sale. When dealers get arrested or supplies get diverted, other dealers and supplies are found or made. Crackdowns make vacuums that are quickly filled. An online version of this, called Operation Onimus, saw the coordinated arrests of hundreds of online dealers, the largest such crackdown in history. What were the results? The prices didn't even go up. It took about a month for the number of active dealers to get back to what it was, shown here, and if there was any deterrent effect, i.e. people thinking twice about signing up to sell drugs, it wasn't much. This shows the number of new dealers signing up per week before and after the operation. There are plenty of individuals willing to step in and fill the vacuum. And so, since addiction is related to crime, crimes are things that society has decided require intervention, but punishments and crackdowns are ineffective, one solution presented is drug treatment courts. Drug courts are an example of an alternative adjudication and correction method. Traffic court would be another example. Mental illness court would be a third. For traffic court, for example, you could be given a choice of the usual traffic ticket and demerit points or attending a class in the rules of the road. For drug court, you could be given a choice of being charged with an offense like theft, possession, or some types of trafficking, or attending individual and group therapy, follow-up meetings with the court, and random drug screening. Another term for these diversionary courts is problem-solving courts. Other courts that you are less likely to have heard of include Veterans Court, Domestic Violence Court, Community Court, and Homeless Court. Still two others that there were at least plans or requests for in Canada include Comorbid Disorders Court and Opioids Court. To set the context, addictions are full of paradoxes, two of which are why we need drug courts. First, the paradox of will is that the control you have is not singular. You have both a will to stop and a compulsion to repeat. You are free to choose sobriety and make promises, and you do, but you do not appear to be free to keep those promises. You are vast and contain multitudes, but one of those multitudes appears capable of destroying your best intentions. The paradox of will would suggest you need some outside help. As Alcoholics Anonymous would say, from a higher power. This paradox says you need drug court. Second, the paradox of values is that you know better and want better than your actions. You value things above your addiction, even if your actions show otherwise. You love your children more than getting high, even though you frequently prioritize it over their well-being. You know you are short on rent or grocery money and that these things are important, yet you continue to purchase substances of abuse or gamble. The paradox of values shows that you are not your behavior, but the judging eye above it. This paradox says you deserve the option of drug court, even if you haven't behaved like it. Diversion from prison and toward more needed help is the overarching idea of drug treatment courts. Accused individuals can apply for diversion to drug court at pretty much any stage of the legal process, before arrest, before arraignment, before trial. To qualify, the offense must be in service of or because of a substance addiction. Stealing for drug money would qualify. Diversion is open to non-violent offenders only, and the court gets to use its discretion in granting or rejecting an application for diversion. Your drug court participation could also be terminated as a consequence of reoffending while in the program or serious non-compliance, which is very hard to find a definition for. The result of termination is likely to be whatever sentence was initially waived, whatever you were diverted from. The court and its agents are also supposed to provide risk assessment to ascertain what should be done with the accused. This is for the protection of society. A common predictive tool for this is the Level of Service Inventory, or LSI. It is a scale assessing the client's risks and needs based on these categories or some similar combination of them. It predicts reoffending quite well and has a professional override option where the clinician or clinicians feel the score does not represent the client well, they can change it, as long as they justify it. It is a good predictor of recidivism for both sexes, and, framed in green here, the LSI is the best tool we have for predicting assault and misconduct when in correctional institutions, where we are interested in protecting other institutionalized people and the employees of those institutions from potential violence. So its scores are used, for example, in Ontario to inform the placement of justice-involved clients in either halfway houses, minimum security, or maximum security locations. But each drug court seems to have its own standard for risk assessment. Edmonton uses a short version of the LSI, Ottawa uses a custom version of the LSI, Toronto has decided against the actuarial approach altogether. It does not conduct risk assessments, but bases the selection of interventions more formally on consideration of a number of factors related to risk to reoffend, including participants' current record, charges, and patterns of violence. Well, that's what the LSI is supposed to do for you in a standardized way. Vancouver doesn't use the LSI, but Winnipeg uses a version. It seems like Toronto is the only drug court that doesn't so much as use a checklist, or at least didn't at the time of the research. At my last count, Canada has at least 9 drug courts. The number is probably higher now. The trend in the United States since 1989 has been a massive growth in the number of drug courts. The stated goals of drug courts in North America are generally to reduce substance use and reduce reoffending. Shown here are some examples from the United States of drug court goals as stated in their own literature. There are differences between courts, but abstinence seems nearly universal as a goal for the individual. In the US and in Canada, the most common form of group therapy undertaken is with Alcoholics Anonymous groups or Narcotics Anonymous groups. The drug court structure in Toronto is shown here. The stages, where all of them are necessary, are arrest, referral, application, bail, probation, admission, participation and treatment, getting plugged into social services, and in some, but certainly not all cases, graduation. There is no singular drug court structure, but there are best practices for what is required of the client, including 100 hours of treatment, done in roughly 3 to 4 months, and at least a 1-year-long follow-up phase. Abstinence requirements vary quite a bit, but generally, courts require 3 to 6 months of consecutive abstinence in order to graduate. Note at the bottom that there is an option next to graduation called substantial compliance for those who may not quite make the 3 to 6 months of abstinence. 4 main drug court application categories include adult drug users, driving while intoxicated cases, juvenile drug users, and opioid-specific cases. The United Nations exclaims that drug courts work. Let's take a look. If the outcome is reoffending, drug court is better than probation. Rearrest rates are lower for those who have graduated drug court. This is the case for both drug and non-drug offenses. In other words, the drug court graduate is less likely to have a second drug offense or to have another offense that is non-drug related. And we see these results in nearly every sampled region, like this small set of samples from the US. Other findings include drug court graduates who do reoffend tend to go longer without reoffending before they reoffend, and drug courts have reduced prenatal and infant drug exposure, which anything that can do that is great. And the longer clients spend in drug treatment court, the less likely they are to reoffend. A dose-response relationship, or a third variable of conscientiousness. The drug court results tend to be better for older clients, those who are employed at the time of the offense, and those with more education. The top reason why people choose drug treatment court is to avoid jail, but it's clearly not the only reason. To graduate, you must have been abstinent, participated in treatment, not committed further offenses, and engaged with opportunities presented by the program, like skill building, getting housing, or doing volunteer work. Top predictors of drug court failure or termination are less than high school education, unemployment at admission into the program, cocaine as your drug of choice, violation of any of the rules in the first 30 days, and your criminal history, specifically the number of offenses, and antisocial personality, specifically something called criminal thinking. Participants list all of these reasons as motivation for continuing with the hard work of drug treatment court. One reason why drug treatment court has better outcomes than probation may be the greater chances for monitoring, feedback, and other attention. Clients get much more contact with supervision officers, many more drug tests, and much more positive and negative feedback in drug court versus probation. Clients tend to report that everything helped, including the rewards and punishment and support from family and friends. And when clients are asked what about the drug treatment court could be improved, the top 4 answers tend to be increasing positive incentives, increasing the intensity or frequency of the treatment, increasing the educational opportunities and vocational opportunities, and increasing the frequency of drug testing. People know that it keeps them honest. Since all that seems like sunshine and rainbows, I'm going to present a few criticisms and then, after the outro, a long list of positive testimonials, most of which are from Toronto. Criticism 1. Low graduation rates. Many drop out. Some finish with substantial compliance, but very few actually graduate. The United Nations give this laudable statistic for Canadian drug courts. Only 11.6% of those who complete the program recidivate. Compared to some numbers we saw earlier, that is excellent, but what percent of clients complete the program? If I have a university and I only graduate 10% of the students, that's probably going to be the 10% of students that would have been successful whether or not my university was any good. We at least know that graduation rates for drug treatment courts are abysmal. Winnipeg leads the country with 36% of clients graduating, but most other courts hover between 10 and 20% graduation rates, with Toronto, at least at last count, at 6% of its clients graduating. Recall that you can successfully complete drug treatment court without graduating. It's called substantial compliance. So what we need to know the dropout rates, or the failure or termination rates. This quote comes from the Canadian Department of Justice in 2016. According to it, 2/3 of drug court clients fail out, but many of those who fail out still benefit from the program. So the failure rate is 2/3, and the graduation rate is around 10%. So there's lots of room here to be skeptical of the United Nations, implying that drug court can take the credit, when really it may just be the third of participants who would have been successful without the drug court. That's no argument in favor of prison, and we have seen the material value of drug courts, even just from an operant conditioning standpoint, but I would not call this sunshine and rainbows. Another criticism that is actually a whole set of criticisms, there's a lot contained here, is that many, in fact nearly all, best practices in addictions treatment are not being followed. Only 37%, for example, of stakeholders and staff surveyed responded that treatment plans were individualized. They're all supposed to be individualized. Only 32% said evidence-based approaches were used. Only 21% said culturally appropriate treatment was used. The list goes on. Finally, the drug treatment courts situation is a coercive one. Admittedly, from a clinical standpoint, it is the good kind of coercive, forced choice, which tends to have actually the same efficacy as non-coercive treatment. But it is coercive treatment in a disease model paradigm. Clients have criticized this environment for its lack of trust and for not being treated like a person. Clients complain of demeaning rewards like a card for a free coffee or praise from a judge. There is a strange uncertainty among clients as to whether they can say no to things, like when a drug court was introducing a new drug test and it had clients give twice as many samples to help them validate the new test. The clients were in a gray area as to whether they could refuse being part of the experiment. Can I say no to giving 2 samples? Or would I go to prison for non-compliance? And to get a sense of the potential psychological toll of this totalizing situation and the self-alienation that can come with the disease model more generally, here is someone named Billy, who is trying his best to absorb the local ideology and be a good citizen. Billy told me that when a person is using drugs, they do not exist anymore and are replaced by a different personality. I try to tell them, I say to my mother or friend or somebody who's using, I try to tell them, it's really not that person. You're not dealing with that person. That person doesn't exist anymore. It really doesn't, And so don't try to compare, because that person is no longer there. That person is lost, They aren't there. That's a different personality. It really is. It's true. You just become something else for your drive to use. This poor person just wants to do the right thing, and he's being utterly dismantled and destroyed in his attempt. The disease model is great for the first few minutes because you get to say it's not your fault, and various other things that the client needs to hear. But an important question is, then what? How can you help the person put themselves back together? The very thing you've taken away and fragmented is the one thing that they need to move forward as an individual and not just someone following orders. I would not want to be in Billy's mind, nor would I want what's in Billy's mind in the minds of my loved ones. From my perspective, the disease model philosophy is a necessary evil, but it is both of those things. And if you're not quite following, ask yourself, what is Billy supposed to do if he's been sober for a year or 2 years and then he relapses? How is he supposed to interpret that relapse? A dormant personality returning to take control of him? How is this different than a demonic model? It's all you, Billy. You are vast and contain multitudes, and it's your responsibility to contain those multitudes. And you don't get better at that by multiplying entities in the person 2 box. You get better by understanding your behavioral contingencies. Anyway, positive testimonials after the outro. That's enough for now. Stay tuned.
Treat me like a throwaway. Every time it's a lost cause Sunday. Turns around, there's an okay Monday. Every time you're not around, it's like a holiday. I'm getting tired of it anyway. Don't say it, don't say it. Everything you ever say is just another story. Just save it and save it. Just because you say the words, it doesn't mean you're sorry. Excitement wears me down as much as I'll run around. What I give for a normal Tuesday, already know what I'm in for Wednesday.